Thank you so much for joining us. We are here today to actually hold a session on the theme, No Climate Justice Without Gender Equality and Sexual Reproductive Health and Rights. Because women and girls continue to be disproportionately impacted by climate change, especially those in the global south. So again, we'll move on to the local perspective and move on to our last speaker, that is Jane. Jane is the dedicated and result-driven individual who works at the Center for the Study of Adolescents in Kenya as Policy and Advocacy Officer. She holds an undergraduate degree in social work with a Master's of Arts degree in project planning and management. Jane has over 10-year experience in the sexual reproductive health and rights sector, working with different stakeholders and different vulnerable groups. So Jane, we would love to hear a bit about the integrated programmatic approach and some of the positive effects, results, such as the integrated approach that you are going to be bringing about to us. So we'll also love to hear about your experiences, especially working at the national level and the local policy space in Kenya, especially in the context of sexual and reproductive health and rights and gender.
Thank you, Fatou, and I'm happy to be here in this panel addressing the nexus between SRHR, gender equality, and climate change. So I want to take you all virtually to the global south, more specifically to East Africa. I hope we are all going there virtually. And in East Africa, let's go to Kenya. And in Kenya, let's go to the coast. At the coast, there's a county called Kilifi County. It's one of the coastal counties in Kenya, where we are implementing a project on sexual reproductive health, rights, and climate change. So in this particular county, the poverty levels are quite high. The education levels are also low. And the food insecurity in this area is high because it's a coastal county, and really they don't do much of agriculture, and they rely on food import from other counties. And access to sexual reproductive health, rights, information, and services is already a challenge due to the strained health systems in the country. And therefore, you can imagine with the challenges that already exist in this county, and now with the impacts of climate change on top of that, what the residents of this particular county go through. Imagine a young woman who is a fish trader. Currently, there are floods in Kenya, especially at the coastal region. And the floods have made roads inaccessible. Access to food is also a challenge. And of course, this is due to the impacts of climate change. And unfortunately, the coast region was worst hit during this particular time. So imagine a young woman who engages in a fish trading business. And with the floods that are going on, she's not able to get enough fish to sell from the, of course, in this particular region, we have the Indian Ocean. So she's not able to get enough fish to sell, which means she's not able to get income to take care of her household as she would wish to. And the roads are also not accessible, which also means that she cannot access sexual reproductive health information and services when she needs to, and which essentially means that she cannot exercise her health rights due to the impacts of climate change that they are currently witnessing in Kilifi County. So the project has our project objectives. We look at them in two different aspects. We have advocacy, whereby we are advocating for SRHR to be included in policies and plans in the country. And essentially this means that when this is included, then we'll have funds allocated for the same, and therefore implementation can also happen on the same. So having integrated policies that really prioritize sexual reproductive health and rights. And for empowerment, in Kilifi County, we work with the beach management units, which is a Fisher Folk community, and the community forest associations, which are communities that live adjacent to the forest in the area. And by working with them, we create awareness to the women for them to be more aware of their sexual reproductive health and rights, gender equality, and also increasing the opportunities to engage in implementation of nature-based solutions, and also holding the duty bearers accountable for the protection and fulfillment of their rights, whether it's health or related to environment. And in our integrated approach, as we implement this particular project, First of all, it's multi-sectoral, which basically means it brings together various key stakeholders. In the project, we work with the Department of Health, we work with the Department of Gender, we work with the Fisheries Directorate, we also work with the Environment Department, specifically the Climate Change Directorate. Because for us, we realize that as an organization that is, our core mandate is on sexual reproductive health and rights, and with this kind of integrated project, we cannot only work with the health department, but we have to bring together all the various key departments and work together to address the climate change impacts because it affects various sectors. That's why we are looking at it in a multi-sectoral approach. We also encourage participation of communities. There's no sustainable solution if we do not involve the communities in our work. For us, from the onset to even did a needs assessment, whereby we involved the beach management units and the Community Forest Association, just to get to know what are some of their needs as we come in to address the nexus between SRHR, gender equality, and climate change. What are their needs? What do we need to prioritize as we address this nexus? So for us, of course, participation of the communities, involving them in our plans, in our implementation, so that they own up this particular intervention. For sustainability, we do not want to just tick a box, but we want sustainability in our intervention. And in a gender transformative approach, we also look at it, whereby, of course, when we talk about gender issues, we're looking at equal opportunities for both men and women. And in this particular context, of course, we've engaged in trainings with the groups, whereby we also encourage women to equally engage in nature-based solutions through the trainings that we offer. In Kilifi County, the norm is that the women will be left at home to take care of the household, while the men will go out and engage in the conservation activities. But in this particular intervention, we also encourage the women to be part of decision-making, to engage in conservation efforts, as much as we also focus on the SRHR component, for them to be part of both dimensions and not to limit themselves to just being at home and taking care of the home. They can also participate in decision-making at the community level, which is what we encourage through this project. They engage in mangrove restoration and conservation. They also mobilize their fellow community members to access sexual reproductive health information and services. We also have access to SRHR services. When we look at the nexus, for us, we look at also offering a wide array of sexual reproductive health and services. When we have community outreaches at the community level, where we take these services closer to the community. And what we do is that we work with the health department, and we also work with the public health facilities within this particular project implementation site, so that we are able to take these services closer to the community. Anyone who's interacted with the fisher folk know that these people hardly create time to go to health facilities for services. So as a start, we decided to take the services closer to them, work closely with the public health facilities through the health department to also encourage a referral. Through that, the community also creates a rapport with the public health facilities, and referral is enhanced, which we've seen. Now the communities can easily walk into a facility because most of the services are free. But previously, most of them were not aware that you can just walk to a facility, get to ask about any sexual reproductive health information that you'll wish to know, and also access services, whereby most of the services are free. So we do, in our community outreaches, we do offer cervical and breast cancer screening, HIV testing and counseling, as well as contraceptives, a wide method, we call it method mix. So they're able to choose whatever they want, whichever SRHR service they will wish to access. And when it comes to some of the positive aspects of the integrated approach, we've seen a holistic benefit, whereby the communities have gotten SRHR information and services, of course, much closer to them, and an enhanced referral system within the community. And they've also been trained on conservation. The coastal region, there's a lot of mangrove degradation at the moment. So we've seen a lot of many community members engaging in marine conservation and restoration, as well as also getting more information on their sexual reproductive health and rights. So we've seen a holistic benefit to the communities. Unlike before, where we would go with a project, a health-affiliated project, and only focus on the health indicators. But in this particular integrated approach, we look at how can we help the community in a holistic way. So there's the holistic benefit. There's also joint accountability and partnerships. This project is being implemented in partnership with the WWF Kenya, Worldwide Fund for Nature, Kenya. And therefore, we work as a team. We bring our expertise, both as Center for the Study of Adolescence and WWF, whereby when we approach, when we have community activities, outreaches, we're able to share information on both health, environment, and even gender, not only limiting ourselves to, personally, the norm will be I will limit myself to health information, but that is not the case. We've even seen our health practitioners now talking about conservation during our community activities, which is a plus for us because they were also amazed at how health, gender, and climate change really interlink. And now they're able to talk about the nexus easily. And it's also cost efficient. Imagine going to a community as an organization that is, whose core mandate is on health, talking about health today. Tomorrow, another organization goes and talks about conservation. The next day, another organization goes and talks about gender. We even make the communities get tired of us because we all want their attention and not forgetting that they also have their own lives going on. So when you come as a team, it's cost efficient. We're able to jointly sit down and plan, which we do together with the departments. We jointly sit down and plan our activities and engage in our intervention as a team.
Definitely. Thank you.
As I conclude, on the last slide, on experiences with policy, this is very key and I need to mention it. In Kenya, of course, we're also facing the challenge of integrated policies, having SRHR referenced in some of our policies and our plans, and case in point, the National Climate Change Action Plan. They've done a lot of course, consultations with various stakeholders, but when it comes to having SRHR referenced in these documents for budgetary allocation, for implementation, it is still a challenge, lack of prioritization. But one way that, in which we are approaching this is collaboration through networks and alliances. As a team, as a group, you have a bigger voice as opposed to doing it alone. Working in silos, of course, is also still a challenge. Most sectors are still looking at their work in silos. Even here at COP, you find in some sessions, people still have that siloed way of thinking. So it's time for us to look at it as an integrated issue. Climate change is integrated, it's multifaceted, and we need to have also comprehensive solutions for it and ensure that SRHR is being addressed and prioritized as a resilience and adaptation strategy. And finally, we need proper documentation on the benefits of integration for these to be included in these documents. A lot is being done. A lot of good work is being done to address the nexus, but I think it's time we package this work well for it to be really recognized and prioritized as a key area. Thank you very much, Fatima.
Thank you so much. We need to share our knowledge. We need to make sure we use our voice, our power to share our stories and our life experiences. So what's your message?
Mine is let us break the silos in policy formulation, in funding, in implementation. That is the only way we'll achieve integration. Thank you.